Typically, when I get a mammogram done, I feel uncomfortable with the pinching and the pulling.
I felt very nervous, anxious, and because of the discomfort. It was painful, and I had pain even few hours after the procedures that I did.
They've put off their mammogram for 3 or 4 years because their experience was so uncomfortable that they didn't want to have to do another mammogram again.
I don't have very large breasts, and so it's very uncomfortable when you are small-breasted to go and get a mammogram. So you just realize that it's going to hurt, it's going to be sore, and you might be bruised. And so you kind of have that anxiety that builds up. However, you need to know.
When the women come into the exam room, if they're extremely anxious, it becomes harder for us as technologists to get accurate images.
If the patient is not comfortable, then you can't pull the breast fully onto the detector to get a good image to review.
Now that I've had the opportunity to try the SmartCurve system, I would definitely opt for it every time. It's much more pleasant. It didn't hurt nearly as bad, and it didn't leave marks across my chest.
I noticed right away the difference. I was able to notice less pinching, and even though there was pulling, it wasn't uncomfortable as prior experiences.
Most of our women said that they didn't have the discomfort in their upper arms and underneath their arms and the medial portion of their breast. They were very comfortable. After we finished the mammogram, they were all just raving, couldn't believe that the curve hadn't happened before.
It was softer, if that makes sense. You still had to compress, you still had to be on the machine, but it didn't pinch, it didn't bind nearly like the previous system.
They were happy to see that it was nice and curved and friendlier looking. Didn't look as if it was going to hurt them in places that they were used to hurting.
I tried curve compression and it was very comfortable. It was less painful and less pulling and less pressure.
Because it's more comfortable, the anxiety levels do lower.
If we can put that anxiety at ease, it allows us to get a better quality image, which will give them a more accurate diagnosis.
I was actually able to compress more and get a better image in those patients, which surprised them because they felt like they weren't compressed as much. With the SmartCurve system, the radiologist commented on how much better detail and compression we got in the upper portion of the MLO, which is the axilla, and also the inferior portion of the breast, which we didn't get very much compression at all in the MLO, especially in larger breasted women. So in the CC view, the radiologist commented on how much better compression and detail they got in the lateral portion of the breast and also in the medial portion of the breast.
Actually, after I had tried the SmartCurve system, I went home and I called my family because I have several people in my family that are in the same situation I am, and I was like, oh my gosh, this was so much better. So it was a really good experience for me.
I've been telling my friends and my family members that they should try it. They should try to use this because it's less painful and it has less discomfort.
Any tool that we have that can help with the compression, I think would put the women at ease. So if we can explain that ahead of time, we have a new device, it's going to help with compression, it will be more comfortable for you. I think that will have the patient relax and we can get a better quality study.
I'm very excited about the SmartCurve system because the patients their comfort is very important to us, not just diagnosing them, but knowing that they're going to come back.
I would definitely recommend facilities that have the curve compression because it was a great experience for me.
It makes you feel good knowing that as a woman, they're looking out and they're saying, you know what, let's use a product that's going to be shaped like a woman, that's going to be soft curves versus hard lines, and somebody's listening, and that makes you feel good.
As technologists, it makes our job easier, and also, because we are in the field and we're dedicated to helping women and early diagnosing breast cancers, it's important for us to see women come in and keep coming in. And the Curve device helps us with that. It's a friendlier device. It makes us look friendlier, so everybody wins.